virus hitting some patients harder than others, and researchers say it could all come down to their blood type. Dr. Frank McGeorge takes a closer look.
Several months ago, a research paper looking at patients in Wuhan and Shenzhen, China, suggested having type A blood was associated with a higher risk of acquiring COVID-19 than other types, and type O blood appeared to have the lowest risk of infection. Now, this paper remains unpublished and has not gone through peer review. Subsequently, though, a group of researchers at Columbia University in New York looked at the blood type and severity of disease in over 1,500 patients diagnosed with COVID-19. They also found a higher proportion of blood type A patients and a lower proportion of patients with type O blood who were COVID-19 positive. They did not, however, find that blood type had any relationship to the risk of requiring intubation or dying from COVID-19. Now, this paper is also preliminary and currently unpublished, but taken together, both of these papers raise the question of how someone's blood type and ultimately their genetics could be important. Two more, even newer studies are trying to answer that. A preprint study from Germany evaluated the genome of nearly 2,000 patients with COVID-19 respiratory failure from 7 hospitals in Italy and Spain. They found variations in a person's genes in at least 2 particular places in the human genome were associated with an increased risk of respiratory failure. One of those places includes the gene for blood type.
Well, it's going to be expensive to get a drug that's been shown to help severely ill COVID-19 patients. Gilead Sciences announced the price of remdesivir today. A typical treatment course will cost $2,300 for people on government insurance. That'll be more than $3,100 for people covered by private insurance. The actual out-of-pocket cost will depend on your plan.